Okay, welcome to the chapter lecture 12 review for dental anatomy, dental school prep. So this week we covered, there's kind of three different things that we talked about. We talked about tooth anomalies and then kind of some abnormalities that go on with different parts of the teeth. And then he has a little part where he talks about ethics and what comes after dental school. So options for starting your business, starting your career, or like continuing your education. So a lot of it is just memorization. So the way he has it set up, there's tooth anomalies, which are just random odd things, irregularities with your teeth. So he goes through a couple of general types, and these general types have some overlap, so they're not like distinctive groups, but they are important to kind of know. So you have extrinsic anomalies, which arise from physical or chemical trauma. It's basically, extrinsic is like outside, so it's kind of just outside forces acting on your teeth. And then you have intrinsic anomalies, which arise from heredity or like genetic mutations. So again, intrinsics kind of like coming from inside. Then you have congenital conditions, which occur like on or before birth. We'll see some of these happen from like, STDs cause problems with your teeth. We talk about that a little later on. And then there's familial tendencies, which the evidence is inconclusive for, but it's kind of just based about of like inheriting tendencies from your family members. And then there's hereditary conditions, which are directly related to like your genetic makeup. So then there's a couple different groups that he breaks them down into. So he starts off with shape. The shape ones are, I feel like, a little easier because there's kind of like you can put an image in your head to the term. So macrodontia is just the teeth are too large. Microdontia is the teeth are too small. Pterodontism is we have large pulp chambers. Turner's teeth is hypocalcification of one tooth, and it's usually an incisor. Dens in dente, I can't remember how he said that, dens in dent, is a tooth within a tooth, which is kind of easy to remember because of like dents and these dents. Peg laterals are when your maxillary lateral incisors, they don't form the full crown, and so they just kind of look like pegs. And then you have mulberry molars, which are just irregularly shaped molars, and that's from congenital syphilis. And then you have Hutchinson's incisors, which are your incisors have notches in them, and that's also from prenatal syphilis. Then there's a couple with like joined or multiple teeth. So gemination is a splitting of the tooth germ into, and it can either result into like twin teeth, or you can have a bifid tooth, which is a tooth with two crowns and one root, share the root. There's fusion, where 2 to 3 tooth germs unite while they're developing, and they'll be joined at the dentin. And then there's concrescence, which is where it's fusion, but they're joined at the cementum, and that's usually in maxillary molars. You have root anomalies. The root anomalies are there's a dilacerated, which just means there's like a sharp bend or a curve in the root. You have accessory roots, which are just extra roots, additional ones. And then you have dwarf roots, which are like short roots compared to their crown heights. A couple of anomalies that can happen with crowns is you can have either the lack of cusps or you can have extra cusps. And he mentions when you have extra cusps, they're usually lingual cusps. And then there's also some anomalies in tooth number. So supernumeraries are just extra teeth that can be normal or abnormal. Supplemental means that they just resemble a normal tooth, so it just looks like it would be a normal tooth. When they're conical, they're cone shaped. So conical is like cone shape. And then a tubercle is just a tooth that's really small. It's like anatomy, like a tubercle is like just a lump of bone. It's like a small tooth. I guess that kind of makes a connection. And then you can have hyperdontia, which means you have like multiple extra teeth resulting in abnormalities. And you have mesiodens, which is an extra tooth in the middle of the maxilla. And then you have parodons, which is an extra tooth that's proximal to the molars. And usually you have like the distal molar, which can also be called a paramolar, just your fourth molar. So it's extra for those. And then we have anodontia, which is a condition of having too few teeth. And I think all cases it's like a congenital abnormality. After this, we kind of start talking more about abnormalities with like enamel, dentin, cementum kind of stuff. So there's quite a few for the enamel. So enamel dysplasia is what like its over broad term is. And then there's a bunch of different subcategories of that. So you'll have enamel hypoplasia, which is your enamel super thin and then it's like pitted on the outside. When it's local, it's just caused by an infection in like the deciduous or the primary teeth, and it's just one tooth. When it's systemic, then it's affecting many teeth, and usually if it's a hereditary infection, then it's going to affect all of them, both primary and permanent. Amelogenesis imperfecta, it's hypocalcification that shows like super thin enamel, and it chips away usually. Hypocalcification is part of that, and it just results from the insufficient growth of enamel crystals. Enamel lamellae or cracks in the enamel due to early trauma. Hypoplastic enamel is the normal enamel density. You have normal enamel density, but it's just very thin. And then enamel tufts are small areas of hypocalcified enamel at the DJ, and it extends like a third of the way through the enamel. And then you have enamel spindles, which are odontoblasts wrapped between ameloblasts. With dentin abnormalities, he has dentinogenesis imperfecta, which you can tell it has a translucent hue to it, and the color of dentin is either gray, brown, or yellow. And that just means that the dentin fills the entire tooth, including the pulp chambers, and the enamel chips away pretty easily. So it usually occurs in both primary and permanent teeth of the same patient. Dentin dysplasia is super similar to that. Like the dentin obliterates the pulp chamber, completely fills everything, but the tooth has a normal color and the enamel doesn't chip. Then you have interglobular dentin, which results from poorly calcified areas called dead tracts, and odontoblasts that have died and left empty dentinal tubules. And then sclerotic dentin is when the tubules have filled up with dentin and appear to be transparent in their roots. Pulp abnormalities, there's just one we talk about, it's pulp stones, which are small circular calcified areas on the pulp. Root abnormalities, we have enamel pearls, which is the epithelial root sheath cells that remain and become ameloblasts and then form enamel in the root. So pearls usually form in a bifurcation or trifurcation of the root, so like the point where the trifurcation or bifurcation happens. Accessory root canals, it's just root formation where the canals form in the apical region, and they're just like extra root canals. So makes doing a endodontic treatment a little harder.
Take care.
Take care. We have epithelial rest cells, which are remaining cells of the epithelial root sheath found in the periodontal space adjacent to the tooth. And if the mitotic division occurs later, then cysts can develop. In the cementum, we have some cementum dysplasia. Hypercementosis is a deposition of excessive amounts of cementum, usually around the apex or entire surface of the tooth. Cementoma is hypercementosis, associated with localized destruction of bone. Odontoma is tumorous anomaly of calcified dentin tissue. And then the large blob usually has an unspecified shape, and when it's complex, and when it's compound, there's several small masses resembling little teeth. So I don't know if you guys have ever seen on the internet where there's like a dentist or a kid in like India who had like 300 something teeth. It was just compound odontoma, and they just like pulled all the little masses apart and decided that they're teeth because they just look like mini teeth. Whereas complex, it's like all globbed together, it just doesn't have a shape. Pigmentation of enamel and dentin. So we talk about tetracycline staining, which just results in yellow, brown, and gray teeth, and it happens during crown formation. We have erythroblastosis fetalis. Sorry, it's discoloration of the primary teeth that can be green or brown. And it's usually when a child becomes jaundice. It can cause the circulating pigments and staining to tissues of the teeth to be off, and it happens in the first 3 months. Enamel fluorosis is just a form of enamel hypocalcification. due to excessive amounts of fluoride during tooth development, and it will be like small white flecks or large opaque areas or even brown spots on the surface of the teeth. So that's all that we cover for those like abnormalities. You know, just kind of a lot of memorization, trying to make sure, you know, if it changes color, what color it's being, you know, if it's like a growth, where does that growth happen, kind of the contents of that. And then he goes into what comes next. I don't really remember if he asks like a lot of questions about this on like exams or anything. If he would, it would just kind of be, you know, like which one of the following is like a career choice you could follow. And he just goes through, you know, benefits of, you know, if you choose to go with the military, if you choose to pursue like a residency and specialize, if you do like a public health service program. He talks about going to corporate or becoming an associate at an office rather than starting your own practice or like buying a practice from someone. So it's just, you know, a lot of good details that you should be aware of when you're looking to graduate and to try to decide what to do. So do you have any questions? Okay, cool. Well, I'll let you guys get out of here. Thanks for staying.